Hi, I'm Dr. Rhea Hogseth, founder and director of the Pediatric Dental Assistants Association. There's been quite a lot of focus recently on safety in your office. So here are some tips to run some surprise drills to catch your team off guard, but actually have them work through the process of what you have set up. So you could do a fire drill back in the clinical area. You could either take a piece of paper and just write fire on it and put it somewhere waiting for somebody to find it, or you could get fancy and actually print out a picture of a fire. Then whoever finds that has to start the fire drill. Do it while patients are there, that's just fine. You just want to make sure everybody knows what they're doing, in what sequence, and make sure everybody is getting out of the office nice and safe. It could also be an emergency drill, not necessarily for fire, but something else that you need to get them out of the office. You could place the same thing in an admin area and have everybody again make sure that the fire process, the fire drill process that you have is functional. If it's not, then make the changes in it to make it work better. You could also do a health emergency drill in your office. This could be something like a grandparent fainting out in the reception area, or could be a diabetic who is going into shock and is sweating and feeling very bad. Use your imagination as to what you want that health drill to be. Do the exact same process. If you want to, you could even have somebody in the know out in your reception area and they could act the part. See again how it's functioning in your office, who does what, and make sure that you have this process down pat. And then you're also going to want to have a really intense health problem in your clinical area. It could be something as simple as a patient fainting after they've had their extractions. I know that's happened in my office. It could be somebody who is experiencing a seizure in your office. So again, you can enroll a patient to do that if you would like, or you can get one of your own team to do it and be the patient having this problem. You want to do it not announced. You really need to see if this is going to work and make the modifications that you need to make sure everybody's on board. Then we all know that we need to practice our protocols for a sedation emergency. Those are a little bit more serious, and definitely you want to do some drills with that. I would suggest doing them planned, and then at some point in time when you think you've got that down, do the same thing with a sedation patient having an issue, whether you're needing to rescue breathe or what, and run through that same protocol. Practicing these processes that you have in your office are going to make you all feel much better. You're more competent and you're more experienced and you're confident that you can handle anything that comes your way. I'm Dr. Rhea Hogseth. This is your Practice Pearl from the PDAA, and I'll see you on the next one.